Welcome to Ask the Chiropractor. I'm Dr. Corey Rodnick from Midland, Michigan, and it's great to be back again. I'm a chiropractor here for many, many, many years. They call me the old guy. So anyway, it's great to be with you guys, and today I'm with Jeremy Phipps from Rodnick Chiropractic. He's a massage therapist, and we're going to talk hello there.
Hello there.
How are you today?
I'm good.
Excellent. Beautiful day. It's a beautiful day here in Michigan.
Indeed.
So, people hear about massage, and they have all kinds of misconceptions. Tell us a little bit about that.
Well, as a medical massage therapist, one of the biggest misconceptions is that it's just a luxury service. But massage is very beneficial in treating people in chiropractic settings, physical therapy settings, spine and pain clinics.
Really? So what kind of things do you work on there?
Some of the common conditions that I help treat are scoliosis, sciatica.
I know it's great with all kinds of like muscular problems.
Just general muscle tightness and stiffness, low back pain, neck and shoulder pain, which often results in migraine headaches. And by loosening the muscles, it can help prevent and get rid of migraine headaches.
Well, that's always a bonus. I've had migraine headaches. Kind of a totally weird thing. I have the whole color thing, and it shakes and it moves, and I can't see basically. So yeah, I've been getting massages most of my life. Since I was a little kid, my dad would take me in. Once a week I was getting a massage by a big giant, well, I was small back then because I was younger, big giant Russian guy. He'd beat the daylights out of me. And go ahead.
And there's another misconception. A lot of people think that massage has to hurt to be therapeutic, and that's not the case. There's a couple of particular techniques, myofascial release being one of them, that are designed for people who may have had significant injuries and can only tolerate light touch. And another technique would be cranial sacral massage, which is also designed for people that aren't able to tolerate much pressure at all. I
know you work with a lot of people with car accidents, motor vehicle accidents. I mean, you work with other people too, don't get me wrong. But right. I mean, I know that you see a lot of auto injury people. Yeah,
more recently, I had somebody that came in. They were suffering from migraines, low back tightness, low back pain, and after the first treatment, the migraine headache symptoms were gone, and within another month or so, they discontinued treatment because they were doing so well.
Very cool. It happens. And then you have the other kind who never they're just surviving. So kind of works both ways, doesn't it?
Yes, there's people that I've seen over the course of a couple of years, things that they may have inherited genetically. They may have parents that may have had spinal fusions or more serious conditions that they've been able to avoid by doing massage therapy. I have people that come and see me once a week. In the case of automobile accidents, some people may start by doing as many as 3 massages a week. And the goal over the course of treatment is to reduce that to once a week or once a month, or in some cases, make a full recovery and not need the massage services any longer.
So because their muscles are in spasm, or is it because the ligaments and tendons can't quite hold everything in place, or?
In the case of people with they may actually have spinal injuries, which can be very hard to treat. And you mentioned spasms. that's one of the cases where you're using very light pressure techniques such as the myofascial release. Is doing a deeper, like say a deep tissue massage will trigger and actually make symptoms worse. But I've had a couple of people that I've treated with significant spinal injuries where we were able to reduce their pain for them until they were able to receive surgery.
So depending on what kind of the patient comes in with, you have to adjust the technique or the pressure on what it is you're going to do to help correct some of that.
Yeah, and some of that can just depends on the individual. There's people that, you know, they may not have, they may be getting massage treatment, but they don't have a injury per se. They just happen to be more sensitive and don't tolerate as much pressure. And having a background in social work, I was actually a social worker for 10 years before I returned to school to be a massage therapist. And communication is very key with the people that you're treating. You can be the best massage therapist on the planet, but if you're not communicating with the client and giving them the service or the type of treatment that they would like to receive, then it's not going to be beneficial.
So what kind of training did you have to go through to become a massage therapist?
I attended school at the Naturopathic Institute over in Mount Pleasant. That was a year-long program. I actually graduated in November of 2006, and I actually continued to work as a social worker for a while. I've been doing massage as a full-time career for 6 years now.
Wow. I know you see a lot of people. I definitely know that.
I do. One of the things that was beneficial to me is for doing medical massage is I started out in a physical therapy clinic. So I learned a lot of the exercises that physical therapists have people do. So not only do I treat the individuals when they come in to see me and I'm doing treatment, I can give low impact exercises for people. Maybe people are just having, they frequently have cramps in their calves or old ankle injuries, and sometimes just when they get up and they're making coffee in the morning, when they're standing in front of the coffee pot, doing heel and toe exercises can help make a difference before they start their day.
Sounds fun. Sounds fun. I know you've helped me quite a bit on different occasions from different things, depending on what I came in with. Sometimes I'll blow out a shoulder or my neck because I got electrocuted and things like that where I have different problems. I know you've helped me with that before too.
Right. I remember when I first started, it's just last Friday, November 1st, was my 2-year anniversary.
Wow.
At Rodnick Chiropractic. And when there's a switch of massage therapists, that some of the clients can be a little bit uncomfortable. I remember one in particular that was a little nervous with me at first, but after doing treatment for her for a period of about 3 months, we started to see a significant improvement in her symptoms.
So if somebody's looking for a massage therapist or looking to get better and they're going through maybe a motor vehicle accident or spasms, or what would they look for? What would be the kind of things that someone should be looking for when they're in that situation?
You know, one of the things that they told us in school and that I hear from a lot of my clients is just word of mouth. You know, ask around and, you know, find people that you know who are seeing a massage therapist, and, you know, they're usually, you know, friends and family are usually pretty good at recommending somebody that's, you know, good at what they do and that they'll be comfortable with treatment.
I know that for you have to go real light sometimes or real heavy sometimes, depending on who it is. For our people out there, what would you recommend them to say to the massage therapist that, you know, hey, you know, there's some people don't even like to be touched ever. So you have that on one end, and the other one says, "Come on, get a running jump and get on that thing." So,
Right.
what would you recommend there?
Well, something for me is just when I'm doing a massage for somebody, I'm just I pay a lot of attention to nonverbal cues. If somebody moves in the slightest bit, if somebody's getting, massages are a wonderful thing. And a lot of times people get quite comfortable. Some people even fall asleep. So
I'm one of those. I fall asleep.
So if they lift their head a little bit, or they squirm a little bit, I lean over and I'm like, something wrong? Is there something, is there something I can do to make you more comfortable? But usually I'm just paying attention to nonverbal cues that tell me they might be uncomfortable. And there can be a lot more communication with somebody their first couple of visits as I'm getting more acquainted with their preferences, and then over the course of time it can be a totally silent massage. When I was going to school, something that they coached us is not to talk during a massage, but there are people that are more comfortable receiving their massage if they're talking, during their massage, and I just try to.
I know being quiet for you must be a real task, because you're a social worker, for God's sakes. Okay, just throwing that out. Like, yeah.
Right. Well, when I was a social worker, we had this concept of person-centered planning, and I think that was a really good lesson that I learned before being a massage therapist. And like I said, you can be the best massage therapist in the world, but if you're not giving the person on the table what they want, they're not going to be happy, and they're not going to return for another massage.
Maybe they're living their life miserable. Boo yes, we don't need more miserable people out there, right? There's a biggie.
And speaking of misery, massage isn't just beneficial for medical conditions. It can also help with mental illnesses. Massage reduces stress. It can be effective in treating conditions such as PTSD, anxiety, depression.
Well, those are biggies. Huh. I would think for the soldiers coming back, that would probably be a good idea.
Yeah, and I have treated some people that have been with a military background with significant PTSD. I've treated people where I've been doing a massage, and generally I start with the low back and kind of work my way up to the shoulders and the neck as I'm going, and then as I'm finishing up with working on the back, I'll go back and check my work back over, and if somebody's having a really bad day, sometimes those muscles can tighten back up, and stress and anxieties that people may be suffering at that time can be the biggest X factor in how well they receive the massage. Or sometimes I have people that I can just tell that they're thinking a lot about something that's troubling them, and I just try to, just.
Some people wear it in their shoulders, the stresses, and some people wear it in their necks. And
in my room, my massage room, I have relaxing music playing in the background, and I have as dim lighting, as possible. And again, when you get people that just they come in and they fall asleep. Friday, the coldest day of the year, or of this fall, I think there was 4 or 5 people, because I had my room so warm, that were coming in from the cold. They fell asleep during treatment. So
that's nice. Sounds relaxing. Sounds enjoyable. Yes, indeed. I love it. Like I said, I've been getting massages forever. Not enough. I never have enough time. I always screw up, and then I come secondary to the patients, you know, so I let them go first.
Well, and I get patients that ask me all the time if I get massages. Well, I work a busy work schedule, and I know I should fit in time for a massage. I have difficulty, in doing that, but it's it's a very beneficial.
It is.
Part of a weekly routine.
Like me, I need to get chiropractic care on a regular basis, and I sometimes forget. Like you work all day, and then I come out, I totally forgot to get adjusted. It's like, dang it, it happens though.
And and that goes into another misconception. People think that if they go to a chiropractor or go to a massage therapist, they're going to become dependent on it. But that's not the case. Even for me, I get adjusted like every couple of months. My back might tighten up a little bit more, or maybe I have more challenging clients that I'm working with, and get adjusted a couple of times, and I'm good.
Yeah, you are. You get adjusted, you're done for quite a while.
I do a lot of massages.
And you're very physical, and but you're very healthy. So, yeah. I know if we don't get at it, we might be a month, 2 months out, but when you do need it, it beats the hell out of you if you do need it. So you could tell, a little bit, because you're not right. You know what I mean? You're not 100%. Your level of doing this seems to get at you a little bit. That's one thing I've noticed. But pretty healthy. You got a healthy spine. That always helps. Yes, indeed. So, yeah, go ahead.
Oh, I was going to say, and I brought a prop with me. Something that I've done in my massage career is that I've done pregnancy massage. And for when it's recommended that pregnancy massage begins after the first trimester, and usually when somebody gets to about 6 months, we start using this pregnancy pillow, and this just goes on top of my massage table, and it gets covered by the fitted sheet. I had somebody that I did massages for last, and we probably did 20 massages for her. We did about one massage a week, and she wanted to come in and get a massage. She was going to be induced on a Tuesday, and she wanted to come in that day and get one more massage before she was going to be induced. But I didn't have an opening for her, so she came in and on Monday. But that made all the difference in the world for her. Something that she told me was that, it would be nice if she could have 2 massages a week, because after a massage she would sleep just like when she wasn't pregnant for 3 or 4 nights. And so, like, if she could have been able get 2 massages a week, she would have been golden. So
the technique for a pregnancy massage compared to a motor vehicle accident massage is a little different.
It is, and again, up until you need to start using an adaptive, there's also pregnancy pillows that aren't, for before they're that far along, that aren't quite as significant as this. But by the time they're 6 months and you're using this, you're cutting down on the massage time too. A lot of clients, for the last portion of their massage, they're face up. But with a pregnancy massage, they come in, they'll probably want to use the bathroom before they start the massage, so that they're going to be comfortable on the table.
That's always a good idea.
And usually they have to go, by the end of the massage, so you'll have them, so you don't go as long with a pregnancy massage.
I know some chiropractors don't do pregnant women. I know I do, and I have similar depending on what month or how big you are. It's not so much by the month, but the bigger you get,
Right.
have the right size pillow. And so they can lay on their stomach and they can, yeah.
Right, and that one particular client that I was talking about, she wanted to take that home, but she's like, if I had one of those home,
I could sleep
at
on my
home,
stomach.
I would spend 24 hours a day in that because it's a sense of weightlessness in that.
That's fantastic. Well, that's pretty fantastic. So, is there anything else you want to tell the audience that before we finish up here? We got a few minutes. Well, yeah, go ahead.
Oh, I was just going to mention, I jotted down some of the other benefits, and I mentioned some of these, and I'll just run down my list here. Benefits of massage, reduces stress and anxiety symptoms, and we already talked about that. Another major benefit is that massage increases circulation.
Yes, it does.
And lowers blood pressure.
It also increases the healing rate because the blood is what brings about the nutrients. So when you're increasing circulation, let's say to a muscle
Right.
or tendons or ligaments, you're going to bring about faster healing rates. So
Yeah, it brings the fluids to the level of the skin, and then, like you said, to the individual muscles is one of the ways that massage is beneficial. We talked about improving sleep habits, increases skin health, and again, that goes back to drawing blood and other fluids to the level of the skin.
yeah, absolutely. There's, I know you do some neuromuscular re-education, which is, go ahead, tell me about that.
Neuromuscular re-education really gets into the therapeutic end of massage. It's a technique to help retrain the muscles and nerves to work in coordination. When you're doing therapeutic massage or medical massage, you're including stretches and range of motion activities. I have people that we've really increased the range of motion in their neck and shoulders. Another thing that comes to mind is frozen shoulders. There's a particular manipulation that I do that sometimes I get people that their shoulders just locked right up, and before I start trying to manipulate it, and I have a lot of clients who come in and tell me, how much better the range. They might not have been able to raise their hand, all the way above their head. They might have, when they started seeing me, they were only getting to this level where they're able to, reach all the way up.
It's fantastic, yes. I know it's just more techniques and more different things. It's just a different name for it's different, but it describes what you're doing better sometimes.
Right, and I mentioned the migraine. When you're helping somebody, like say with a pregnancy massage, it's just really rewarding because you hear about the pain and that can be associated with that. And I've had multiple clients that have come in with significant migraines, and over the course of treatment, or even I've had people come in with severe migraines. One time I had a woman come in and she had missed a week of work, and when she came in to see me as I was doing treatment, it kind of freaked me out because she started twitching while I was doing her massage, and I was wondering she was falling asleep because it was the first time that
she slept on a week.
She had slept.
That's funny. Well, Jeremy, thanks for being on the show.
Well,
we appreciate it. And
thanks for having me.
Thanks for being so informative. It was terrific, and we totally appreciate it. And for all of you out there who didn't know anything about massage, now you know a little bit more. And certainly nothing to be afraid of. And like he said, ask some of your friends, who you trust and feel good about, who they see and who's their masseuse. Yes, indeed. And for those who need medical massage, that's obviously different than the feel-good massage. That one, there's chiropractic offices have massage. Some of the physical therapy people have massage. Those are ways of looking at that.
Right, and I don't want people to think that, for me in particular, I have the dim lighting, I have the therapeutic music playing in the background. I try to make it as spa-like as possible, while also, making sure that the massage is therapeutic.
Gotcha. All right. Well, we're going to see you with our next guest, and I appreciate it. Thank you very much. One more time.
Thanks again.
Yes, indeed. Hi, and welcome back to Ask the Chiropractor. And this is the second half of our show. We had Jeremy Phipps on earlier for the massage part. And now we have Angel De Jesus from Midland, Michigan. Master karate champion. Wonderful to have you, man. It's great that you're here. Always love having you on the show.
Yeah, I appreciate that, Dr. Ron. It's
yes.
an honor. It's an honor being with you. I mean, this gentleman, this doctor, have been my chiropractor for almost 30 years now,
Whoa!
In the 90s, how many years ago? You blink and look,
Poof.
you change,
Well, my beard grows in better now. That much I do know.
But as we get older, like instead of teacher of karate, then became master of karate, now I'm a grandmaster of karate, now I'm a 10th degree. For the last 2 years, I got awarded a 10th degree black belt.
Yeah, tell us about that.
Yeah.
That's amazing.
And that take like everything, has to do with tradition and history and consistency, discipline, because you don't realize that you continue to do an activity, and through times, the years go by, but you're building something. And suddenly somebody say, hey, what are your credentials? And you gather all your credentials and say, here they are. They say, wow, we've been watching you for the last 30 years too. So, because you got involved, well, the story is like this. Are you obedient to your teachers?
Yes.
Isn't that true? My instructor, Grandmaster BCU, back in the 1990s, he said, I want you to go and learn from Professor Rami. He's the founder of modern arnis. He's a Filipino stick fighting, to melt both styles, the Taekwondo and the arnis, which is knife fighting, stick fighting, and so on. And he said that, he asked me to, so I met the professor, he became my teacher also. So you're talking almost 30 years later, I was able to connect the Taekwondo and the arnis into one style. And to those two, I add a third one, which is Brazilian Jiu-Jitsu. When Jiu-Jitsu came into being in the 90s, we were doing it, So we had grown up with that, with Brazilian Jiu-Jitsu. So we had three styles mixed together. Taekwondo, modern arnis, and Brazilian Jiu-Jitsu. Then they saw that, and they saw the dedication, and the last thing I know, I got awarded a 10th degree. So I have my own style called Taekwondo boxing, And it's not much. People don't see that I don't have big muscular body or things like that. And today you look at the MMA fighters and everybody's bulky, built up, I'm from the old days. Long muscle, stay thin, keep the body muscles just under control rather than bulking up and losing it. No, stay thin, long muscles. And all through those years, one thing comes to be, which it is grandmastership, like you as a doctor, Tell me about you as a doctor. I mean, you are known all over the world too. I mean, but you have done it consistent, right? Step by step by step.
Persistence was omnipotent.
Amen.
It was you got to just hang in there and keep going.
So in September 15 or September of 2015, in November, they award me the 10th degree black belt. So
just everybody knows, In Michigan, how many 10th Dans are there?
I think it's about 7 or 8, but there's a group that they have been training since the 60s and the 50s. These people are truly who they are, you know. They are grandmaster. They are 10th Dan. They have been for 50, 60 years training. They are truly what they are, you know. Now, compared to the nation, we are blessed that Michigan, believe it or not, was a good hub for martial arts since the beginning, since the 50s, you know.
Oh, really?
Yes.
Huh.
That's why Grandmaster BCU came to Michigan, and he's part of the, the first textbook ever published about Taekwondo. My instructor, Grandmaster BCU, is there. And that was back in 1972 when they published the book. And he has a 5th-degree black belt then. So that tells you he's ranked in 1972. And this is how Taekwondo was introduced to America, to the United States. Then Grandmaster BCU was connected to Grandmaster Hamcha Kyo, which is the guy that lift up, sidekick, and knock over a ball. You know, a ball, a hole, a ball, Really, this is a true story, to demonstrate the power that you can generate with Taekwondo. So he also was my instructor because Master you see what I'm saying?
Sure.
Then Grandmaster Chunri, he's known as the father of Taekwondo in America. He's the one that taught Congress how to do martial art also. This is true story. Those are the people that he allowed me to mix with and learn from, So actually the combination that we teach at you're one of my students too anyway.
Yes.
The combination like punch. And
I sure do.
That come from Grandmaster Chunri. Yeah, that
yes.
come from Grandmaster Chunri, which now he passed on and he's out there in the heavens, hopefully with the Lord. And that's the foundation of Taekwondo, and I'm honored that I learned from them. Because I'm, how you say it, maintaining and keeping the tradition and improving the tradition. Does that make sense?
Yes.
So it has been quite an honor. So that's why they gave me the 10th degree black belt because of
amazing. Just amazing.
Yes.
I know you're dedicated. I know that you're in there and you're every day.
And the next thing that I added to it is firearms. Firearms to the martial arts. Look at the movies. What do you see in the movies? They know how to punch, kick, jiu-jitsu, but they know how to shoot too, right?
Yes.
Well, guess what I do? The same thing.
Same thing.
Same thing. I'm a real one, though. I can do the fighter and shoot also. I am not just a movie star.
For real.
Yeah, for real one. Yeah.
Well, you're a movie star. You're here today.
Yeah, I shouldn't have said that. I said that I'm building my head up or something,
That's right.
Yeah. But that's one side. The other one is the years is consistency and discipline and exercise. Had to do that. Let me say, you know what superposition is, right?
No. What's
okay.
superposition?
Superposition, it means that you have one object and you put another one on top, another one top, another one top, and becomes one. But then they are entangled with each other. You see? They entangle. It's like a communication. The easy example is that you are a doctor of chiropractic, but you got more than one PhD, right?
Yeah, I have two doctorates.
Two doctorates, so you see, but you're still the same person.
And a bunch of degrees.
A bunch of degrees, so it means that you are superimposed with different type of level of information. That's superimposition. One person, many aspects to it, And being a martial artist, being also a preacher. You know that I'm a preacher too.
Yes.
I'm a doctor of theology, and I had traveled just to preach and teach what I do. I've been overseas. I've been in for example, in Rome. I've been in Turkey. I've been in Greece. I've been in Jordan. I've been in Egypt. I've been in Israel. I mean, doing what? Learning. Seeing the reality of what the book says, the hunger for making things better as a preacher, because they had to be a progression of learning, maturing, and one of the things that we don't do much of it is open the book and read. Then take that book, put it aside, say, the book said, let me look at this other book, and this book tell you more and enhance more. Like I'm very, very proud of learning about I call it the secrets of Judaism, and the reason I said that because that's the history of mankind, and people don't realize that. They don't look at that. But when you travel, you get to see the genesis of things. So the same way that I treat the Bible and I teach my martial arts and I teach, I'm also a process control analyst. I used to work for Dow Corning too, and my last title was process control analyst. So I analyze everything. So anyway, what I just finished saying is a superimposed individual with different.
Back to me. It's good that you came back. Okay.
Anyway, enough of me. So exercise. What are the benefits of exercise?
Oh boy.
You know?
So increased circulation.
Number one.
Okay, getting the joints working again, getting them better. Bringing about a well-being about yourself, because it also creates endorphins and brain chemicals. It also, the body itself without exercise deteriorates, atrophies, which means disintegrate, I guess you would say, in the muscles. So it brings about that part and allows your body to keep healing itself, and on and on and on. There's so many benefits.
Wow. You see what she just finished saying, but that's connected to the brain, all that function, right?
Correct.
You see? And so even the body, believe it or not, is superimposed too. Because your brain affects your body, because a person that's lazy is not motivated where? In the mind. So if you don't exercise, are you motivated? No. Who's going to motivate you? The mind. I'm going crazy here, don't I?
You just said something. It reminded me of something. You've heard of Jack LaLanne?
Yes.
Okay.
Yes.
He was an exercise guru when I was a kid.
Yeah, he
was
was jumping jack, by the way, guys.
Yeah, like when you do a jumping jack, he's Jack. He's Jack of jumping jacks. Anyway, my point is, when I asked him, do you like to exercise? And he says to me, hell no.
Who does?
I'm not expecting that answer. And I'm like, he says, I just can't outweigh the benefits.
That's something.
I'm like, he didn't say, yes, I love exercise. He says, hell no, I hate exercise. That was so funny to me.
But that's the truth. You have to force yourself to exercise, you know.
And for again, who don't know him, he was the juice guy for a while. He was the guy on his birthdays, he would pull, 50 canoes or whatever, 50 boats with his teeth while he's swimming. What a nutcase. Anyway, but amazing. And he was a chiropractor. And his daughter's a chiropractor, too.
There you go.
No one knows that either.
See?
But anyway, he said that, and for the rest of my life after I heard that. So for me, I exercise, and then I'll hurt myself. I'll fall. I'll have some giant guy, screw me up or something, because I work on people. So I could be injured, and so it sets me back for a day or two where I'm not doing anything. I'm like, oh, woe is me, wings broken. But then I get back. That's the secret of it.
Yeah,
you got to start again.
But not even that, because, if you don't understand chiropractic, that's a hard work. People don't realize that. They don't realize how many you got to work with hundreds of people. I mean, you got to maneuver. You got to learn to use your body, how to do what you do. That's tough work. So you got to be in shape to do that. Okay?
Correct.
Absolutely. But to be the best you can be, you have to exercise. You have to work your muscle because you want to do your best. Something is forcing you to do it. You see, your willingness to do your work better, your exercise to be in better shape. Well, in exercise, for example, people don't realize this, but martial arts is one of the oldest way of exercise. People don't connect to, they don't connect them, And it's go beyond just the physical aspect. I keep mentioning the mind because that's the one that make it happen, and we don't realize. The physical is one thing, but like I got to say at the school, which it is, what is fitness, And I ask people and they give you the definition. Well, fitness is to be exercised, to be fit, to have muscles. And I say, no, my opinion. My definition, ain't just karate definition. Fitness means strong mind, strong body. But you cannot have a strong body without what? Strong mind, And that's what I said, that mindset sometimes defeat purpose of improving and getting better. That's why the lazy guy is hard to get from the sofa to go and exercise, because he enjoys more sitting down and eating and not being active. But if he changes his mindset, it's different. That's why the mindset about exercise and martial arts. Well, I just don't sweat and exercise. I'm developing a skill at the same time I'm exercising. You see? So you start to mix things too. At the same time, I'm developing my mind. My neurons start to work better. Why? Because when you repeat an activity over and over and over, there's one side of the neurons that continue to build and build a better insulation for that signal when it fire up. I forgot the name of it. But the point that I'm saying is that we're all connected. So to be healthy, to be strong, you need to have the proper mindset, the proper exercise to develop the right skill, then take care of yourself through chiropractic caring, for example, also supplementation, nutrients, yeah, and get educated, get informed, stay on top of new information, be willing to change to improve yourself, The other one is like when it comes to supplementation, do you guys ever heard about Nerve 2 activator? You guys don't even know what it is and how much it does for you. People don't even know that. And because they go to a point and they stop, they don't continue to improve what they have learned. That's why exercise is awesome, but it's like we had gone backwards. Okay, what I mean by that is that people exercise 1 week, 2 weeks, a month, 2 years, then I'm bored of that, they start doing something else. So what they do is becoming a lot of trades, but master of none. With martial arts, you develop, again, your physical body, your mind, and at the same time taking care of your body through chiropractic and supplementation. And don't take anything into your body that if you don't know what you're taking, don't take it, unless you understand what's the purpose of whatever you're taking going to do to your body. Again, chiropractic proficiency. I go get it twice a week. I almost see you twice a week regularly. Why? Because if I don't, and that's the truth, man.
That's the reality.
How many times I go dragging my leg and you go over there, pop, I walk over, thank you guys, on my way again, And that happens constantly, And I'm now 63 years old. I am not calling that's old. This is the new 20, to be honest. If you stay in good, healthy shape on it. But again, going back to exercise, it is not just to exercise your physical body. You have to exercise your mind. You see, and as another aspect is meditation.
And your spirit.
That's what I was going to get on, meditation, Why meditation? People think meditation is that we tend to forget that we as an individual have an inner power that we haven't even touched. Me, as a believer, I believe, for example, in the Lord Jesus Christ. I believe in the Lord of the Hebrew Bible. I believe the Lord of the Christian Bible. So I call it the Bible, right? So nobody fights, Everybody got their own. But anyway, the idea is that that's an internal thing. It's not for the outside. Even if I take my little thing over here, like that probably you right there, that you think that's who you are. No, there's more to you. You might be a little bit more of yourself. But you don't realize that. But when you become a spiritual, you start to see from the inside out. And you start to put things together. Say, wait a minute, who I am? And then sometimes you wonder, who are you? Say, well, I grew up this way, this way, this way. Yeah, but was that you? Or that was given to you through the people around you? But there's a time that you come and your eyes open and you realize, wait a minute, that's not me. I can make myself better. Mind change start. You follow what I'm saying?
I totally follow what you're saying.
So when we get to be a spiritual, that is when you take time to ask the entirety to guide you and to become even a better being and person in all areas.
For me, I meditate quite often myself. And you notice in the Bible, there's a few meditations in there.
Mm-hmm. Quite a few,
especially, David liked to meditate a lot. Mm-hmm. And they wrote down what he said and what he did, and they use that as an example. If you want to meditate, here, go through this, or go through that one, or blah, blah. There's a gazillion of them.
Gazillions of them,
one of the things I like to say at the end of when I meditate, this is just one little piece. And again, some people think, meditation's bad. It's all through there. It's been there for thousands of years already. Mm-hmm. So it's simple. I like to end mine with, I am in the world, but not of the world. I affect the world does not affect me.
That's amazing.
Just that.
Repeat it again so they can hear. Say it again.
I am in the world and not of the world. I affect the world does not affect me, because I want to be the spiritual being housed in this carcass of flesh, and I want to keep that thing working so that I can use it.
There you go.
And then I go out, and I don't want to be, there's so many negatives on the planet, and you can get involved in all these, and it's, I want to be able to affect that.
There you go.
So I remember when I was at 9/11, there's an example. So everything's blown up, burned down, bodies everywhere, fires. It's crazy as hell. And
He went to New York, by the way. I know he spent some days over there, too.
I said, I'll give a couple of guys a day off, because I know they were working 7 out of 7 days. And I know God said, take a day off every now and then. That's the Judeo-Christian things that affect the world. We got weekends.
Amen to that.
Anyway,
Yeah.
the Jews said Friday to Saturday, Saturday to Sunday was the Christians. We got weekends. So I thought that was great. So anyway, I'm down there. I was like a light. I mean, it was like a light. I was like a light down there. For these people were so horribly negative. Because, your friends die, you're digging, you're lifting concrete. So physically, emotionally, it was very stressful. And
that is the point.
Chemical, wait, I forgot. And also poisoned, because they were chemically... The gas masks were not the right gas masks for that environment. They weren't used to that environment, so everybody's lungs were poisoned. So anyway.
And that's why you said that event even changed your life, changed all our lives. But that information didn't come from inside. That thing that affected your life came from the outside, was trying to what? To get to you.
I just showed up.
But you showed up and started to bring a different reality to the whole perspective.
So they wanted to hire me for emergencies, the United States emergency thing. Those guys wanted to hire me. I mean, not hire me, but hire me.
Yeah.
And I'm like, I have 5 little kids at home I left. I can't just go running around every volcano, every earthquake, every wind blowing the fires. So I didn't quite do it, but they liked me.
But you were a light. And that's the whole point. The light came from within, went outside to affect the world.
And I wasn't trying to get anything. I was only there to serve. I was just total servant. And it's really tough to serve a fireman, a policeman. Those guys are servants. They don't want anything.
No, they want to give, but they don't want to receive anything.
They don't even know how a lot of them.
That's another thing. That's what I love the police. I love the military.
Fantastic.
I'm also a military guy, by the way.
Yeah.
So it is like, because the desire is to help others to maintain a clean and beautiful and peaceful society, And when there's a struggle, they are there. The fireman, the other day at the school, there was one of the ballasts went out or whatever, it's making real bad. The parents said, fire or something like that. I said, call 911. Who comes rushing? Fire department. Instantly, So again, they are willing to say, but they don't want to sometimes receive much,
They're not big on that.
They're not big on that.
Not big.
But we love you anyway, guys. So being a light, that's the whole thing. The light is not for you to affect yourself. It's for you in a positive way to affect what is around you, your surrounding, to bring light, to bring a peaceful environment, to bring a joyful environment. Like you're always going, man. You're always happy. You always say, next, there's a problem. You say, next, and you move to the next one, and it's like you're alive. Some people might even get offended because you're that way. You know that?
I have upset a few people.
It's kind of weird,
Mr. Smiley, I can't stand it. So we only got another minute left here.
Oh,
so
another already?
That was fast. Yeah,
Man, we didn't get to talk about exercise at all. But if you remember one thing, remember this, that it is knowledge in the mind, honesty in the heart, strength in the body. You got to remember that. Knowledge where? In the mind. Honesty, you need to be honest to who? To yourself and whosoever you are, and you become strong where? In the body. So student creed or Grandmaster Chinri.
Absolutely. It's fantastic. So, again, because I was a student, and I am a student, it's in there. I've been great with that. It's wonderful. And it's always great to have you on here.
Well, Midland, we love you. We always will. And be part to be a light unto others and help change the whole community and the whole world. Thank you.
Thank you. And I like to just say persistence is omnipotent. You know, you get down, something happens, just go ahead and start over. And God gave you the gift of life, and what you do with that life is your gift back to God.
Amen to
So
that.
remember that. All right, we'll see you again next month. Ask the Chiropractor. Have a great day, Midland.